Hi, Dr. B here of AskTheDentist.com. So today I saw a patient that came in with a quote-unquote cold sore. Now, the reason I want to explain and talk about this is because these terms are thrown about loosely. Cold sore, canker sore, and I think it's important to differentiate between the different sores in the mouth. And I think our profession, my profession, dentistry, really hasn't done a good job of making it clear what sore is what and what are the implications. So in dental school, I differentiated or had to memorize these things. I thought of the cold sore as the herpetic labialis, herpes labialis sore, because with herpes you get a fever the first time you come into contact with that. So I thought cold, heat, that's how I remembered it. And so the Aptus ulcer, which is the canker sore, I would think of cantankerous, someone who's grumpy, biting the inside of their mouth, and they would have mechanical trauma and they'd get that sore. So that's how I remembered it. But I would, instead of referring to it as a canker sore and a cold sore, which I really think is too confusing and doesn't differentiate between the two enough, one being very serious, let's refer to them as Aptus ulcers, which is the canker sore, and herpes labialis, which is type 1 herpes, very closely related to the type 2 herpes, which is genital herpes, and it is contagious. So let me explain. So a Aptus ulcer is something that happens inside the mouth. Herpes labialis is something that happens outside of the mouth. Inside the mouth would be all the loose tissues. We call it non-keratinized tissues. Those are tissues like the floor of the mouth, you know, when you pull your cheek out from the inside, anything that's loose, not connected to the jawbone. And they occur in different places. And they are kind of a burning, ulcerated, meaning you lack skin in that one area, and it kind of is a burning sensation, and it's healing from the outside in. So it's like a burn almost. So that is the Aptus ulcer. Not as serious, not contagious, usually biting yourself, you know, being run down. You can burn yourself and get Aptus ulcer after the burn. So that is not that serious. It's uncomfortable. It's inconvenient. Your dentist will still treat you if it is that kind of sore. As opposed to the herpes labialis, your dentist, a good dentist, will not treat you. A hygienist will turn you away and tell you to come back in 2 to 3 weeks. That's usually how long it takes for that viral infection to go away. It is highly contagious. It can spread to your hands. It can spread to your genitalia. And if you get it the first time, which is usually by age 7, maybe age 10, the primary attack is with a very high fever, lots of sores, and it's very painful. Those are little vesicles, little pimples that pop and drain. They produce a lot of fluid, also very painful. So those are the two differences. If you have herpes labialis, of course, you don't want to touch anything, you don't want to go close to your spouse, loved ones, and you certainly don't want to go see your dentist. So maybe this will help you differentiate. Before you go in, you can contact your dentist and tell them, you know what, I have herpes labialis, or I have a cold sore. But certainly know the differences. And here's the thing I want you to know. Go see your dentist anyway, and because we have solutions. We have specific solutions for each one. There's some medications, ointments, all sorts of little things that we have that can actually treat these. In the case of the herpes labialis, it's something that would shorten the duration, also help with the pain. And in regards to the Aptus ulcers, we have things that can just deaden the pain and of course make it heal quickly. If you have any questions, please leave comments below, and we also will have a link and a blog post on this with a lot more details, and actually I will mention directly in that blog post the things you can do, the things that you should ask your dentist on, you know, the different medications and the different methods to take care of this. So anyway, that's the difference between a cold sore, I'm using the old terms, lay terms, and the canker sore. So I hope that helps. Thanks for viewing. AskTheDentist.com.